If your feet stay cold under warm blankets, your calves tighten after a short walk, or your legs feel unusually heavy by the end of the day, do not dismiss it as just getting older. Those symptoms can have many causes. Sometimes the explanation is simple. In other cases, recurring pain, numbness, color changes, slow healing sores, or one foot feeling colder than the other may signal a circulation problem that deserves medical attention. No seed, spice, drink, or home remedy can reopen a severely narrowed artery. Food can support cardiovascular health, but it cannot replace a proper diagnosis, prescribed medication, supervised exercise, or a procedure when one is needed. What you eat every day matters. A heart-supportive diet provides fiber, unsaturated fats, vitamins, minerals, and plant compounds that help maintain normal blood pressure, cholesterol, blood sugar, and blood vessel function. In this video, we'll count down 5 practical seeds adults over 60 can use as part of a balanced diet. We'll explain what each seed offers, how to eat it safely, and which warning signs should never be managed with food alone. Stay until number 1. It may be the easiest seed to add to breakfast, but only when prepared correctly. Before we begin, one safety note. If you take blood thinners, diabetes medication, blood pressure medicine, or several prescriptions, speak with your doctor or pharmacist before making a major dietary change. Never stop or reduce medication because of a food video. Number 5. Sunflower seeds. Often a salty snack, unsalted sunflower seeds are a useful addition to an older adult's diet. They provide vitamin E, unsaturated fats, some protein, fiber, and magnesium. These nutrients support overall dietary patterns that benefit blood vessel health, but sunflower seeds will not immediately relax blocked arteries or warm numb feet overnight. Use them as a nutrient-dense replacement for less helpful snacks. Choose raw or dry roasted seeds with little or no added salt. Start with a small spoonful sprinkled over oatmeal, yogurt, vegetables, or a salad. For people with dentures or swallowing difficulty, sunflower seed butter may be easier. Check labels for added sugar or salt. Number 4. Sesame seeds. Tiny but flavorful, sesame brings unsaturated fats, plant protein, minerals, and lignans. It's part of a cardioprotective pattern when used instead of foods high in saturated fat or excess sodium. Tahini, a paste of ground sesame, mixes easily into dressings, spreads thinly on whole grain toast, or adds richness to vegetables and soup. Portion size matters. Tahini is energy dense. And sesame is a recognized allergen. Swelling, hives, wheezing, vomiting, or difficulty breathing require urgent care. Expect modest benefits, more satisfying meals with healthier fats and minerals over time, not dramatic overnight change. Number 3. Chia seeds. Chia provides fiber and ALA, a plant-based omega-3. ALA is not the same as the EPA and DHA found in fish, and conversion is limited, so chia is not a substitute for prescribed treatment. Its most practical benefit for many over 60 is fiber, bowel regularity, fullness, and improved diet quality when used instead of sugary desserts or refined breakfasts. Chia absorbs liquid and forms a soft gel. Mix into oatmeal, yogurt, or smoothies. Do not swallow dry chia followed by water, it expands when wet. People with swallowing problems or narrowing of the digestive tract should only use fully hydrated chia and consult a clinician. Increase fiber gradually and drink enough fluid unless restricted by a clinician. Number 2. Pumpkin seeds, or pepitas. They provide protein, unsaturated fats, magnesium, zinc, and other nutrients. Claims that pumpkin seeds boost nitric oxide and force more blood into the feet are overstated. They're best used as nutrient-dense replacements for less nutritious snacks. Try a small portion of unsalted pepitas over soup, salad, cooked vegetables, or oatmeal, or blend them into a sauce if chewing is difficult. Watch for heavy salt on packaged seeds. People with chronic kidney disease must be cautious about major changes in minerals like potassium or phosphorus. Diet depends on kidney function, labs, and medications. Large quantities may cause stomach discomfort or displace other important foods. Number 1. Ground flaxseed. Flaxseed offers fiber, ALA, and plant lignans. Research shows generally modest effects on cholesterol and blood pressure that vary by person. Flaxseed may support a heart-healthy diet, but it does not scrape plaque or reverse advanced peripheral artery disease. Ground flax is better than whole because grinding makes nutrients accessible. Add a small amount to oatmeal, yogurt, soup, or a smoothie. Begin gradually. Too much fiber too quickly can cause bloating, gas, or diarrhea. Drink adequate fluid unless advised otherwise. Store ground flax in a sealed container in a cool place to preserve its oils. Fiber-rich foods may affect medication absorption. A pharmacist can advise on timing. Flaxseed ranks first for being inexpensive, versatile, and easy to use consistently, not because it is a cure. Now the part most videos fail to tell you. Cold feet are not always caused by poor arterial circulation. They can be due to a cold environment, low thyroid function, anemia, diabetes-related nerve damage, medication effects, Raynaud's phenomenon, reduced mobility, or other conditions. Leg swelling may point to vein problems, heart failure, kidney disease, medication side effects, or prolonged sitting. Burning or tingling can be neuropathy rather than reduced blood flow. Pain that starts with walking and eases with rest can be peripheral artery disease, but back and nerve problems can produce similar patterns. Self-diagnosis is risky. If symptoms are new, worsening, or repeatedly limit your walking, schedule a medical evaluation. A clinician may check foot pulses, compare ankle and arm blood pressure, examine skin and nails, review medications, and order tests when appropriate. Seek urgent help if a foot or leg suddenly becomes very cold, pale, blue, severely painful, weak, or numb, if you cannot move it, or if you have a wound, blackened skin, or signs of infection. Sudden loss of blood flow can threaten the limb and should not be treated with seeds or home remedies. What actually supports circulation after 60? Food is one piece. Treatment for diagnosed peripheral artery disease often includes prescribed medication, cholesterol and blood pressure management, diabetes care, smoking cessation, foot care, structured walking or supervised exercise, and sometimes a procedure to restore blood flow. Do not stop aspirin, a blood thinner, a statin, or other cardiovascular medication because you added flax or chia. Movement matters too. Long periods of sitting leave legs stiff and uncomfortable. If walking is safe for you, regular structured activity can improve walking ability and cardiovascular health, but exercise must be individualized. Foot care is essential for people with diabetes or reduced circulation. Check feet regularly, wear proper shoes, and avoid intense heat on numb feet. A simple 7-day start. You do not need all 5 seeds every day. Choose one. For the next week, replace one less helpful food with a small amount of an unsalted seed. Replace sugary cereal topping with ground flaxseed. Swap chips for a measured portion of pumpkin or sunflower seeds. Use a thin tahini dressing instead of a creamy, high-saturated fat dressing. Add hydrated chia to plain yogurt instead of a heavily sweetened dessert. Pay attention to tolerance, appetite, bowel habits, and blood sugar readings if you monitor them. Then look at the bigger picture. Are you eating vegetables most days? Getting enough protein? Drinking according to your clinician's advice? Smoking? Sitting for hours without moving? Taking medication as directed? Ignoring a wound or recurring walking pain? Those questions matter more than finding a perfect seed. Final message. The 5 seeds are sunflower, sesame, chia, pumpkin, and ground flaxseed. Each provides different mixes of fiber, unsaturated fats, vitamins, minerals, and plant compounds. None is a miracle treatment. Use seeds to improve diet quality, not to avoid medical care. Use them in modest portions, choose unsalted products, increase fiber gradually, and check with a healthcare professional when medications, kidney disease, swallowing problems, allergies, or multiple conditions are involved. After 60, the goal is not dramatic overnight promises. The goal is to protect mobility, recognize warning signs early, and build habits safe enough to continue. Your legs have supported you for decades. Support them now with sensible food, appropriate movement, prescribed care, and timely medical attention.